Hi, my name is James Roberts. I'm a patient care coordinator here at Find Help for Cancer. We understand that some of you may be looking for just complementary treatments to what you're currently already doing with traditional treatments, or you may be looking to have something that simply takes the place of. These will be all discussions with you and the doctor. We're happy to help, point you in the right direction, and answer questions for you. The videos are meant to help aid you in your healing journey. Please like and subscribe so that we can help others.
This video will be a little longer than normal, but I wanted to cover the problem and some solutions that you can discuss with a doctor in the same video. Let's talk about inflammation and cancer, along with the integrative holistic approach to inflammation. Here's how inflammation negatively affects cancer and ways to reduce inflammation. Inflammation promotes tumor initiation formation. Chronic inflammation from infections or autoimmune conditions can cause DNA damage in cells. Inflammatory molecules like cytokines and free radicals can lead to genetic mutations, a key step in cancer initiation. Example: chronic colitis, an inflammatory bowel disease, increases the risk of colorectal cancer. Inflammation supports tumor growth. Inflammatory cells like macrophages release growth factors that encourage cancer cell proliferation, promote the growth of new blood vessels to feed the tumor, and help tumors resist cell death or apoptosis. Inflammation enables metastasis. Inflammation increases the expression of MMPs, enzymes that break down tissue barriers, allowing cancer cells to invade nearby tissue and spread to other organs. Cytokines attract immune cells that help remodel the tumor environment and facilitate metastasis. Inflammation suppresses anti-cancer immunity. Some inflammatory cells, such as regulatory T cells or myeloid-derived suppressor cells, actually turn off parts of the immune system that would normally kill cancer cells. Tumors hijack this immune modulation to evade detection and grow unchecked. Inflammation promotes resistance to therapy. Chronic inflammation can activate survival pathways in cancer cells. It can reduce the effectiveness of chemotherapy, radiation, and immunotherapy. Inflammation creates a protective shield around tumors that makes them harder to kill. Chronic inflammation is like fertile soil for cancer. Managing inflammation through diet, lifestyle, and possibly anti-inflammatory medications can play a supportive role in cancer prevention and treatment. Reducing chronic inflammation is one of the cornerstones of integrative oncology. Lowering inflammation can support immune function, reduce tumor-promoting conditions, and enhance the effects of conventional treatment like chemotherapy and immunotherapy. Here's a comprehensive guide on how to naturally and holistically reduce inflammation in a cancer supportive context. This should all be done under the supervision of a doctor. When seeking an integrative holistic doctor, it does not mean forgoing traditional treatments altogether. It does not have to be either traditional treatments or holistic treatment. These are simple conversations you will have with the doctor to help with your individual needs. Anti-inflammatory diet, foundation of any natural inflammation reduction plan. Let's focus on some key elements for a healthy diet. Whole plant-based foods are essential. Healthy fats like extra virgin olive oil, avocados, and omega-3s are beneficial. Fatty fish such as wild salmon, sardines, and mackerel are high in EPA and DHA. Colorful fruits and vegetables are rich in antioxidants and phytonutrients. Don't forget about herbs and spices like turmeric, curcumin, ginger, garlic, and rosemary. Integrative holistic facilities often suggest a Mediterranean diet along with intermittent fasting. It's important to avoid or limit certain foods. Ultra-processed foods, refined sugars, and fried foods should be minimized. Processed meats have been linked to inflammation and an increased cancer risk. Excess alcohol and sugary beverages are also best avoided. The Mediterranean diet and plant-forward diets, such as anti-inflammatory or macrobiotic diets, are often used in integrative oncology for this purpose. Chronic stress increases inflammatory markers such as cortisol. Natural tools include mindfulness meditation, breathwork like box breathing, and vagus nerve stimulation, tai chi and yoga, nature therapy such as forest walks, grounding, journaling, and spiritual practices are known to be helpful. Studies show that cancer patients practicing mind-body therapies report reduced inflammatory biomarkers and better treatment tolerance. Quality sleep. Poor sleep increases inflammatory cytokines and impairs immune function. Tips: keep a consistent sleep-wake schedule. Create a dark, quiet sleep environment. Avoid screens 1 hour before bed. Talk with your doctor regarding melatonin. It may also have anti-cancer benefits. Physical activity. Moderate exercise reduces inflammatory cytokines and improves immunity. Aim for 150 minutes per week of moderate aerobic activity. Add strength training 2 times a week. Walking, rucking, swimming, and yoga are great for cancer patients. Avoid overtraining. Intense, prolonged exercise without recovery can be pro-inflammatory. Targeted supplements should be taken under the supervision of an integrative holistic doctor. Many of these supplements will be administered with high-dosage IV therapy. Let's talk about the anti-inflammatory action of some key supplements. Curcumin may reduce inflammatory markers. It has been used for joint pain, chronic inflammation, and supporting general health. In aging, omega-3s, EPA, and DHA lower IL-6 and CRP, and may even inhibit tumor growth. Vitamin D modulates the immune response, and low levels are quite common. Probiotics improve the gut barrier and reduce systemic inflammation. Green tea, EGCG, contains antioxidant and anti-inflammatory polyphenols. These supplements have been studied in cancer care contexts, but always coordinate with your doctor, especially during chemotherapy or immunotherapy. Gut health support. Your gut microbiome plays a huge role in regulating inflammation and immunity. Strategies for maintaining gut health include eating fermented foods like kimchi, sauerkraut, kefir, and miso. It's also important to include prebiotics such as garlic, onions, asparagus. Avoiding gut disruptors like excessive alcohol, sugar, and antibiotics can make a big difference. Integrative medical therapies are often used in clinical integrative oncology centers. These therapies can offer a holistic approach to treatment. Therapy has several anti-inflammatory benefits. Acupuncture can help with pain and chemo side effects. Ozone therapy, as discussed, may reduce oxidative stress and support tissue oxygenation. IV vitamin C in high doses modulates inflammation and supports immune function. Hyperbaric oxygen therapy improves tissue oxygenation and may reduce inflammation. NAC, a precursor to glutathione, supports liver detox and reduces oxidative stress. Magnesium deficiency is linked with increased inflammation. Vitamin D regulates immune response, and low levels are often found in chronic inflammation. Turmeric and curcumin act as potent COX-2 inhibitors, working like natural NSAIDs. Ginger, it's comparable to ibuprofen in some studies. In summary, natural ways to reduce inflammation include an anti-inflammatory diet, mind-body practices, sleep optimization, moderate exercise, targeted supplements, gut health, and integrative therapies. Each of these strategies can play a vital role in managing inflammation and supporting overall health. If you are in the need of an integrative holistic facility for cancer or have additional questions, please reach out to us at findhelpforcancer.com. We are happy to help. Please like and subscribe.
I hope you enjoyed the video. If you're in the need of integrative and holistic treatments for you or your family member, please feel free to reach out to us at findhelpforcancer.com. We'll start with a simple conversation and help point you in the right direction. Happy to help.